Here in Australia, we are seeing outbreaks of Shigella. However, these are happening worldwide, Europe, UK, America. Unfortunately, Shigella is here and it comes in sporadic outbreaks around the world. As gay men, we are in a particularly vulnerable place to acquire Shigella by the way that we have sex. Shigella is a bacteria that lives inside the gut. It is spread through feces, getting into the mouth. The thing about Shigella, though, is that it's a very small bacteria and you only need a tiny amount of it inside the body to get a big infection. We're talking 20 particles of bacteria is enough to cause a significant illness in people. As I said, Shigella is spread through infected person's poo getting inside the mouth. In the setting of a home, that can be through not washing your hands after going to the bathroom and can be spread through food preparation and things like that. For gay men, the way we have sex does increase the risk of transmission. Acts like rimming are a very obvious transmission risk. However, things like if you've, say, gone to a back room, had some sex, and not been able to access hot water and soap to wash up afterwards, there could be fecal contamination on your hands. That could lead to touching of the mouth and an infection as well. For this reason, I highly recommend if you are playing, give your hands a really good wash with hot water and soap after you've played. Clean your genitals with hot water and soap after you've played. You don't need to go crazy. Hot water and soap is more than enough to kill Shigella and break the cycle. If you are unwell, please don't attend large gatherings or sex parties. I know that these events are really important and you've been looking forward to them, but please don't do it. There are people attending those events who could be immunocompromised, and Shigella for some people can lead to hospitalization and needing for IV fluids because of the significant dehydration that can occur. The symptoms of Shigella are they come on about 3 days after exposure, and you generally just feel like crap. Headaches, muscle aches and pains, fevers, but the key signs are diarrhea, and these can be watery, but also include blood and mucus. If you are feeling dehydrated, if you're finding that your heart rate is really high, if you have a hoarse voice or you're really struggling to get up and about, you need to go to hospital and be assessed. In good news, most people recover from this quite well. However, some people will require antibiotics. The way to lead this process is we would need to get a poo sample, so please go and see your doctor and get checked out if you've got fever, muscle aches and pains, and diarrhea, whether it be bloody, watery, or you're noticing mucus come out. It's really important to get diagnosed. It's best to avoid sex after a diagnosis, and to be honest, you're going to be feeling pretty awful, so you may not want to have sex anyway. And let any of your sexual partners know as well to be on the lookout. Hand washing is one of the key ways of breaking the cycle. Warm water and soap is absolutely plenty to break that cycle. Shigella is here. We have sporadic outbreaks every year or so. It's important to keep it on your radar and let's look after each other. If you get any symptoms, seek medical help. If you're feeling really crook, go to the hospital and let them know you've got bloody diarrhea, and they'll be able to offer you the best care possible and diagnose what's happening in your body. Of course, happy to answer any questions if you have them below. Have an amazing day. Look after yourself, and please be aware that Shigella is out and about amongst our community. Stay safe, team.